Hi, everyone. I'm Don McCormick, Chief Storyteller here at Vital, and today I'm talking to Vital's co-founder and Chief Medical Officer, Dr. Justin Schrager. Hi, Justin.
Hi, Don.
How are you doing today?
I'm doing great. Thanks for having me.
So I wanted to get some time with you today to talk about your professional journey in patient experience and where you see the industry going. So what are some of the exciting things that you've seen happen in patient experience, or PX, as we sometimes call it, in the last few years?
When people look at patient experience broadly, there are some modifiable and non-modifiable factors that affect, how a patient experiences their journey through the hospital and the acute care setting. And the things that, especially in the last few years since the pandemic, have been related to the workforce, been related to I suppose, if you want to call it a buzzword, but it's a new discipline of measuring burnout, disaffection in the workplace. It's not a new process, but in healthcare, it has certainly taken off in the last few years, both academically and on the business side of things. And the reason that matters is that and there have been multiple very large, very well done surveys of healthcare workers that have tried to measure this. And they're finding that, in the inpatient and outpatient setting, up to about 3/4 of people that provide healthcare, from the people that clean the rooms to the doctors and nurses, about 3/4 of them have some measurable level of burnout in their job. So you pair that with an aging population, increased demand for healthcare workers, both from the deficits that occurred during and after the pandemic and the sort of demographic shift in our country. That's a big problem, right? And so if you have nobody to take care of an aging population, and you have people that are providing that care feeling like they're overwhelmed with their tasks and under-respected, underpaid, all those things, burnout becomes an operational problem. It becomes an almost insurmountable operational barrier to providing care, to the safety net of providing healthcare, especially in the emergency departments and hospitals around the country. One of the primary drivers of burnout and difficulty at work for nurses in particular is the feeling that they are being asked to do too many things they're being asked to do too many things, and that those things are not possible for one person to do. And those tasks have only ballooned. Right.
Are they asking, do they feel that they're being asked to do too many things for which they were trained, or too many things generally?
Period. Yes, both. I'm not a nurse. I won't speak for the nurses that work at Vital, but also that I work with. But I would say that asking nurses to do too many things is not a new thing. Mm-hmm. We've always asked nurses to do too many things, and they're generally giving people and selfless and hardworking, and they always do this sort of thing. So when they're telling you in these national surveys and their public forums and their policy committees are saying these things, we've already gone too far. But, every time a new innovation comes through with an electronic health record that supposedly makes things faster and more efficient, what actually happens is you wind up with higher efficiency, but more tasks. So the amount of time you spend doing those things, documenting in the electronic health record is no different. You just wind up creating more tasks and completing them in effectively the same amount of time. These are things like documenting all the different scoring systems and stuff in the electronic health record take a long time. And so the technologies I've seen that have been helpful for that have been, or remain to be seen whether they'll all be helpful, but some have shown some promise, are designed to cut down on documentation burden, increase communication, enable these clerical tasks to occur more quickly. And then there are operational sort of AI models that are meant to improve, bedding, staffing ratios, operational throughput, and all the things that go into the running the business of the hospital, which at the end of the day are sort of thought of as ways of improving the experience of care by diminishing these tasks, just by making things more efficient. The times they have patients waiting in a hallway to go upstairs, and things like that, they really just hurt you when you see patients sort of not getting what they need and
Yeah.
sitting there waiting to be transferred to another facility for 3 or 4 days, seeing psychiatric patients stuck in a secure holding room for 3 or 4 days before they can go to a facility. I mean, that stuff is hard to overcome, even on a non-interpersonal level. Even if you're not the person directly caring for that patient right then and there, just seeing it is difficult. And so the promise, I think, with a lot of the AI tools out there is to sort of speed up work and thereby speed up efficiency of the facility and speed up the sort of throughput, I guess, if you want to call it that, and thereby make things a little easier for the staff. That's what the EHRs were supposed to do too. And so I don't think the experience of providing care has improved dramatically in the last 20 to 30 years by anyone's measure. So I think it remains to be seen.
Isn't there a little different dynamic though that might be going on outside the hospital walls that can't really be compared to the days of the entry of the EHR? Is that you've got kids now who are in high school, maybe college, they're using ChatGPT. They were essentially not raised with it, but it when they became of age, it was a thing. Yeah. When they enter the profession of nursing or other clinical activities, or just even working in the hospital, right? Aren't they going to take that sort of thing for granted? Aren't they going to say, well, LLMs and AI have existed in my world for for years. So what does that tell the hospitals in terms of the sense of urgency of we better start putting these things in place now because they're going to be expected by that next generation of caregivers?
I mean, you make a very good point. I don't see any difference between the young, we'll say younger nursing and non-clinical staff joining hospital employment and patients. I mean, patients are experiencing the same thing. They expect certain things when they use services. If I have a patient in the hospital, that patient on average probably has Amazon and uses a airline app when they fly and, does every other little thing with that sort of technology. And man, healthcare is behind with that stuff. Way, way behind. Just the idea of access in and of itself in healthcare is thought of generally as access to getting an appointment, access to talking to your doctor, access to talking to your nurses. When in reality, there's so much more we could be doing to provide access. And vice versa, like access to your patients, access to communicate with their families, access to asynchronously communicate with them with things that don't require a face-to-face communication.
Well, there are quite a few hospitals that are innovative, trying to stay ahead of the curve, or at least maintain kind of that level of expectation that the communities they serve have of them for providing those services, right? So those are the hospitals that are really investing in patient experience, really investing in technology. And many of them actually work with us. We're partners in helping develop those solutions. Can you tell us, as we wrap up here, like 2 or 3 really exciting things that you've seen come out of that kind of innovative mindset?
Yeah, that's an excellent question. We have an amazing group of hospitals using our platform, and some are focused on different parts of it. But by and large, they use it. They use Vital because it helps with the patient communication and setting expectations and trust and access, digital access. And I've seen hospitals do things that I didn't even expect with the platform, and encourage us to do technological experimentation, if you want to say, with regard to patient experience, and truly own it. I mean, the people that use Vital right now are 2 standard deviations off the right side of the early adopter curve, right? They're doing something that no one in healthcare has ever done before, in the ER in particular. I mean, if you go to an ER and you ask the average person who works there, when was the last time a patient thanked you for helping them? It's probably not going to, it's not the most common thing. And the way that patients provide feedback to hospitals right now is 20-year-old technology. It's a survey. You get an email after you leave, or a text message survey. It may happen relatively shortly after you depart the building, but there's almost no attribution to the people that did the hard work to make you better. It goes to the doctor who's submitting a bill to your insurance, right? So when I take care of a patient in the hospital, and they fill out a survey afterward, I'm usually attributed to the survey response, right? What we've done with several of our hospitals, but a few in particular, is enable them to collect patient feedback in real time. This seems like a simple solution, and it is. Basically, we're just asking patients, how's it going? Give us a quick feedback. What are we doing today that's helping or hindering you? That type of question. How's it going? Seems simple, just checking in with them, and patients give us feedback. And the people that run the departments that really care about this feedback, that want to do something about it, are able to action that in real time. So you as a patient are in a room, you've been seen by a doctor, and you get a quick little message on your phone that says, how's it going? You give some response, whether it's positive or negative, and that response will be read in real time while you're in the building. The people providing care for you, whether positive or negative, will hear about it. And it changes behavior. It changes the entire architecture of the way that people go about doing their jobs. It gives people recognition that they didn't ever get before.
But that's unexpected, because a lot of what we see online, there's this negative review bias that we see out on Google all the time. Right, you're only going to leave a review on Google if you found a fly in your soup, right?
Yeah,
but
I think it's.
But you're saying that if you ask the patient, they will graciously respond.
Right. So what you're actually doing is giving a voice to the average patient. Hospitals measure patient experience, and Google, for that matter, with a balance of really angry people and really happy people. They use something called the Net Promoter Score. It overweights people that are really unsatisfied and people that are really satisfied, and vice versa. It's the same thing on Google reviews. If you go and read them, these people saved my life, 5 stars. They treated my grandma so well. 1 star, I wouldn't bring my dog to this ER. And they're reviews right next to each other. How would you decide if I'm going to use that facility or not? Right. And so at the end of the day, what happens is when you ask everyone, the preponderance of patients, how it's going, the vast majority of them have a positive response. If you outweigh the negative comments with a 10-to-1 positive versus negative, receiving that negative feedback is not as harmful for your psyche. It's not as likely to cause burnout. Basically, what you're doing is telling people, like, you're doing a great job. Like, everybody here is doing a great job. You just don't know it. And the nurses that are generally not getting that kind of feedback all of a sudden can. And, it doesn't cost anything other than your time and your effort as a leader in those departments. The platform in and of itself is simple. It doesn't cause problems. We've seen that over thousands and thousands and thousands of these reviews. They're very actionable. They're easy to do. And it changes the culture of the facility.
Actually, I remember talking to one of our clients who it really did help them move their culture forward in terms of showing staff recognition. This particular ED director took all of the comments that they got through ERAdvisor and literally wallpapered the entire break room with these kudos from patients. Can you imagine after a long shift and you walk in and you're just seeing this, like the break room looked totally different, like at the beginning of your shift, and now you're just looking around and you're seeing all this positive reinforcement? I mean, it almost brings it. I'm almost getting emotional just thinking about it. That at the end of a really long day, isn't that what you need?
Every day in the ER is a long day, Don.
I'm sure it is.
Not that I don't like working there. I love working in the emergency department, but we don't go into the specialty thinking it was going to be a easy job. And we also, in general, don't go into the specialty thinking that patients are going to thank us regularly or that the physicians and nurses that we work with in the hospital are going to thank us. And the reason we don't have those things, I think, is that there hasn't really been an easy technological solution that all the patients are using, that is easy to use and easy to operationalize, that doesn't actually add any more work for you to do. Like you're not paying someone to walk around and ask every single patient how it's going, or putting up boxes where people put, 3x5 cards to recognize somebody or anything like that. Nothing wrong with those efforts, but they're old school. Like that's not what people do in every other industry. And it's certainly not something that you can take action on while that person's still in the building. Both the patient and the nurses. I like to think that we build solutions for problems that our customers tell us they're having, and we build them in such a way that they can mold it to the way that they want to do it, right? Mm-hmm. Which we've talked about a little bit. I've seen lots of different ways that this technology has been used in different emergency departments and different acute care settings. And it's amazing when you build a tool that everyone's used to using in their daily life, mm-hmm. and you just give it to people and you say, look, do what you want to do with this thing. You can make it yours and you can own it however you want to own it. And it's amazing what people will do when you give them a piece of technology that they haven't been able to access before. And it's just fun to watch,
for sure.
Honestly.
For sure. Yeah. Well, hey, it's been a real pleasure talking with you, Justin. Thanks very much. For our audience, if you'd like to learn more about Vital's patient experience platform and the ways that people are using it, maybe even beyond the way that we, originally designed it for, please go to vital.io. Thanks very much and have a great day. Thanks, Justin.
Thanks.